before we begin into the complexity and detail of pain, let's discuss in general what do you think about pain, what is pain, and how we perceive it.
Okay. So I'll start by giving the definition of pain. So this definition I've taken from IASP, International Association for the Study of Pain. So they describe pain as a unpleasant sensory or emotional experience which we go through, uh, which may or may not uh, associate with potential tissue damage. So the point to notice here is they consider this as a potential of tissue damage, not an absolute condition of tissue damage.
Okay.
So, so the whole way we understood about pain is like we considered only the biological state of our body, which means our tissue or bone. So when there is a pain in certain area, we assume that there is some form of damage is associated in that area. So
Yeah.
if we experience pain in our elbow, we assume that there is some damage in our elbow which needs to be fixed. So this later with new research and studies, this expanded into like other aspects as well. So now what we call it as biopsychosocial social factors. So biological factors are the factors which we considered before as well, tissue, bone health, and our hormones and genetics, etc. Psychological conditions are our like our own expectations, prior experience with pain, our state of mood, uh, things like that, and psychological factors or the background which we come from, or the surrounding environment which we grew across. So those things, these all three things will come into play when we experience pain.
Okay, so my takeaway from this is the definition you told has three important point to notice. One is that sensory part you told, that pain is a sensory, like you have a sensation into certain tissue, and that tissue senses it and sends signal to the brain. That is the sensory part. And another thing you said, sensory and emotional. So apart from this sensory signaling system, there is emotional or other psychological factors are also associated with pain, and that is something new for me, and it might be new for so many other people, because we only perceive pain as this sensory system, that okay, I'm signaling some pain in my certain body part, that means some damage should be there, and that is why I'm sensing the pain, which is not actually complete picture.
Yeah.
So
to help us understand with a certain analogy, so if we think about pain as a watchman guarding a gate, so pain often comes before we reach the gate. If we assume the gate as the tissue damage or the injury state, and pain as the watchman guarding it, so we encounter pain soon, like way before we reach the gate.
Okay, so that means when we feel that okay, I went for a training, I came back and I am feeling pain in my shoulder, and I am thinking I have injured my shoulder, but it is actually the pain is signaling. Pain is happening before the injury. It is a signal that okay, if you push too much, too hard, too soon, you might injure your shoulder. That's what you are telling me. That pain occurs much before the injury, actual injury.
Exactly. Yeah.
Okay. So that is one part of it. Another thing you mentioned, that pain does not always mean tissue damage. So let's discuss this about a little bit in further. You have told me something because for a very long time I also thought that whenever there is a pain in certain areas, that means if I'm having a new knee pain, I thought there is some problem in my knee. Even if it is not a damage or a structural damage, there is some problem in my knee. But there was one interesting story you told me about, that one nail into the construction worker's boot.
Yeah.
So can you tell me that story?
Yeah. So this happened to a construction worker. So during an accident, he landed on a 15 centimeter nail or something.
Okay.
He was wearing a boot, but the nail went straight through his boot and came out on the other way.
Okay.
So at the site of injury, the worker was not able to move his leg. He was like in extreme pain.
Mm-hmm.
So they have when he reached to the hospital, any movement of the nail was giving him so much pain. So in the hospital, they have to say they have to give they gave him some sedative to remove the nail. So once they pulled the nail from the bottom of the shoe, and after they removed the boot, they came to know that the nail had gone exactly between his toes, leaving his foot entirely uninjured.
Oh,
So
so that means there was no damage, but there was immense
yeah,
pain.
immense
So
pain. Yeah,
even though these examples are rare, but this gives an idea that pain is a brain generated activity, and
yes.
brain is a complex system. So it
Hmm.
makes the pain a complex thing. Pain can
Yeah,
be generated for multiple factors, like you told me some factors that there are other than damage. We only think
yeah.
one dimensional, okay, damage is there, so pain is there. But is it not actually true? There are multiple factors involved. So
Yeah.
now we have come to the second part of it. If there are multiple factors involved apart from damage, let's discuss
Okay.
some of the factors. What are the major factors you think that can affect the process of pain sensing and this generation of brain pain from brain?
So yeah, so I will come to that. Before we go on to that, I will explain like why our brain acts in certain way.
Yeah.
So our brain, the primary function of our brain is to like protect us. So oftentimes this gets misleaded into like it gets misleaded and we get like the wrong signaling from the brain. So if we look at it from like survival perspective, our brain is trying to protect us from potential danger. So the information we draw from our previous experience, that is what the brain will analyze, and it will come to a conclusion whether the situation is threatful or not for you. So if I have to give an example, if someone has have been in a life-threatening injury, uh, for example, like an accident, car or bike accident, they will not experience pain even if they have like some broken bone, because they will be in a they will be in like complete shock state. So this our brain knows that creating pain on that occasion when our life is itself in threat will be like irrelevant. So they will be like, experiencing the pain once they come out of the shock state. So that is one reason we mentioned is like pain is not a accurate measure of tissue damage.
Okay. Yeah. So
So
uh, when there is a when there is a
hmm,
very major injury, that is like there are multiple reports and multiple people have reported this. When there is a very major injury, like a you lost an arm or leg or something, then there is no pain at the time of injury and for the very
yeah,
long time. And when patients are in the hospital and after surgery and all, they start experiencing pain. So there is a
yeah,
so that the point you mentioned is very good point to notice, that when brain thinks that now there is no point in protecting, giving you pain signal and protecting you, so it is not giving you pain. So
yeah,
the point of giving a pain signal is to protect you. So when the brain feels that there is a threat, it tries to protect you. That is the
yeah,
mechanism of brain. Okay.
exactly.
Okay.
So to answer your question, like what other factors will impact our pain signaling? Uh, One thing will be like how stressful you are. So how stressful your life is. So what is your thoughts and beliefs surrounding like pain? Like when you experience pain, what is your immediate thoughts surrounding that? So those things will also have an impact on your pain experience.
Okay. And also, does the environment also plays a role? Because one article I think you have shared me, and in that article, there was one story that someone was going through a bush, and there was a snake bite, and
Yeah.
that person didn't realize that snake has bitten, and he went on. But later, when he realized, that time there was pain. But when he was in that same environment again, passing through the same position, some twig touched his skin, and there was immense pain. So because he
Yeah.
was in the same environment, and brain could recall that this environment, brain can associate with danger. So
Exactly. Yeah.
that's how the pain generated. So that means environment
Yes.
also plays a role here, and environment could be also a factor generating
Yeah.
pain.
So environment and your past exposure to certain movements which created pain, and your
Okay.
thoughts and beliefs. Yeah.
Okay. So
So
tell.
those things.
Okay.
Yeah.
So your belief, like how scared of you of something, and these things can also play a major role.
Yeah. So nowadays we see like when we go to social media, everyone is saying like don't round your back when you deadlift. You must sit in a certain posture, or you will experience like muscle knots or something.
Yes.
So these things gets feeded into our brain. So when we have some discomfort, these are the information our brain immediately goes to process, and it's our brain thinks that this is a threat, and that it creates a like pain experience to protect from us, but it is actually misleading us into not protecting.
This is something really interesting, because the social media and internet is filled with these information where you should not sit in certain postures, and you should. And there are posts where they'll tell you that how many pillows you should use while sleeping,
Yeah,
otherwise you will generate a back pain, and these things are actually not helping but causing the back pain.
exactly. Yeah.
Okay, so
So
we are over informed about the pain and sensing of the pain.
over and misinformed.
Misinformed. If you injured your finger, you won't feel that. You won't be that be afraid of that thing. But if you injured
Yeah.
your lower back, so there is so much fear associated with lower back pain versus your finger pain.
Yeah.
So your fear, your negative emotions, and the background knowledge your brain has about something, that plays a major
Yes.
role. And your beliefs about the pain, what you expect about the treatment. If you are going to for a certain treatment, your expectation about the treatment can also affect your pain sensing. Your
Exactly.
another point is your history of chronic pain. If you have already have a chronic pain, you are oversensitized for the pain. Even something less threatful, something less dangerous can also ignite a very immense amount of pain, like a lot of pain you can experience because you have a chronic history
Yeah.
of pain. And your then comes your lifestyle, how you are eating, how you are sleeping, your sleep, your eating habits, your
Yeah.
movements. So a lot of things makes it a very complex process, and we tend to look at it as a very simple thing, that okay, tissue damage versus pain. So
Yeah.
considering all this, moving on to the next question, how we think. Okay, now we know that there are multiple factors involved. So now coming to the most practical point, what I can do to minimize my pain sensing, or what can I do to rethink or reprogram my brain for the pain sensing?
Yeah. So this is something I've been reading about a lot. So the first uh, step they always recommend in self-managing our pain experience is to educate ourselves.
Okay.
That means like understanding how our pain system works. So as explained during the introduction, right? So the old view of pain, which compares only biomedical model versus the biopsychosocial model. So once you have that understanding, so you know that the pain is like affected by multiple factors like thoughts, feelings, moods, uh, and everything depends on the context of your previous experience. Knowing these things will give you confidence to move, even when you experience pain. Uh, you can pick a movement and then gradually expose yourself over a period of time, and then you can get back to where you were before you experienced pain. So there is one other thing that I have been reading about is this approach. They call it as DIM and SIM therapy. So DIM stands for danger in me, and SIM stands for safety in me.
Okay.
So a typical DIM will be like when we experience pain, right? So automatically we associate with it with a negative emotion. So that is danger in me. So you have to like find out what are all the thoughts you go through when you experience pain, and if you can simply like change it into a SIM thought or an action. uh, as said before, like instead of like over exaggerating the pain, uh, simply like acknowledging it and then believing that we can work through this will change the DIM into a SIM model. So like identifying like what are all your DIMs and SIMs will be like helpful in self-managing about your pain.
Okay, this is something really interesting because I'll tell you what as a my perspective as a patient of chronic pain. I'll tell you my perspective, because you told that there are a lot of negative emotions and negative thoughts and experience involved with pain. So when I used to encounter any new injury, or now I don't even call it injury because I know it's not an injury, it is just a pain signal. Earlier I used to call every pain as an injury. So now that has changed. So whenever I used to encounter any pain, suppose a shoulder pain, so my thought process was, I used to immediately go into a thinking that, okay, what is it? Is it something soft tissue damage? If I have damaged my ligament or my tendon. Soft tissues are they are not healed very quickly. And if it is a muscle tear, how long it is going to take? Or I have damaged something in my joint, in my ball socket joint, or some problem in my joint. So I used to immediately start thinking in the structural, what are the structural damage I caused? But now I know in reality there might be no structural, or there might be irrelevant structural changes which are not going to hamper any movement or not going to affect me in any way after a certain time. But I used to immediately associate my pain with some structural damage. And the next thought was, how can I diagnose this properly? Like, where should I go? Which doctor I should meet? And what MRI or scan, CT scan I should get it done, so that I have a proper diagnosis. And next process was where I can go for a rehab or what exercises I should do. And so there was a this thought process was not like, so first day I'll think this, then after 5 days I'll be in the next stage. And this will lead to me ultimately thinking that, okay, now my training will stop. I can't go to the gym. I can't lift my weight because I have injured my shoulder. So these things used to grow so much that I used to completely stop training because I was so worried about my shoulder that I'll stop my training, my lower body also, with injuries in my upper arm. But I'll start everything, I'll stop. And later I'll think, it is my brain which was making it worse. There was a minute pain, but my brain was making this so big that it used to get so worse. I'll start reading online lot of things. But the thing which I want to mention it here, when I'll go and read about online, I'll not read about the pain. I will read only about the shoulder, anatomy of shoulder, muscles in shoulders, and what muscles and what tendon or ligament or joint can be damaged, and different pathologies related to shoulder. But I never went and read about pain. So that is the one reason that I am doing this discussion with you, because most of the time we miss that the signal part can be the problem, and there should be then there might be no tissue damage or any structural changes. So this trauma which was causing me pain so much, this trauma was self-generated rather than my shoulder pain.
Right.
So this brings us to this discussion that okay, when we want to reprogram our brain, the first step is knowledge. As you said that we should consider that there are other factors involved. Then the next step is once you start considering these steps. So you told something which I didn't know, that DIMS versus SIMS. So once you start acknowledging that okay, this signals what I'm thinking, what negative thoughts I'm getting, these thoughts and signals might not be real. So immediately it get converted into SIMS. So what you think as a danger, it not might be that danger. And then comes the part where people get stuck. So I'll ask you, my next question is on the next part. Once you get the knowledge and you start rethinking about the pain, so most people, and I have also done this, most people start restricting themselves from movement. So if I have a shoulder pain, I'll start to give a rest. Okay, then there is an acute phase, then there is a chronic phase. For acute phase, most of the people will get rest. But after acute phase is over, I'll be so scared to move my shoulder or lift a weight. So what we should do in that condition, should we avoid movement completely, and how long we should avoid movement, or we should not avoid movement, how to go about it?
So this is something I have gone through as well. So when I experienced my lower back pain, so you can at the initial stage when the pain is like too much, I was resting for like 1 or 2 days. I wasn't able to move. I was just lying on my bed and I was doing my work. So and then it got better, but I also did the same mistake. I stopped training. My team at Strength System advised me not to do it, but I didn't take that advice. At that time, I did not have this understanding about pain and all. So it went like this for like 2 or 3 months, and my condition eventually keep on getting worse. So what happens when we stop moving is so when we stop training, our baseline of fitness will also decline. So when we start to when the pain settles down, when we start to train again, our baseline, since our baseline fitness also declines, we will not be able to we'll start to train, and then we'll get to experience some kind of flare up again.
Okay.
So we will we'll get into a loop of starting movement, experiencing pain, stopping movement, and then it will continue.
Yes.
Yeah. So to avoid this is the one thing I came to know is keep continuing movement. Like you said, when you have experience pain on your shoulder, try to train your lower limb part, lower body.
Yeah.
And find some tolerable movement. It could be as simple as moving your limb which you are experiencing pain.
Yes.
It doesn't have to be a loaded movement.
Yes.
It can be just moving around your limb. In your case, your shoulder, to a tolerable level, and then gradually progressing it from there.
Yeah.
So that is how you will build tolerance. Yeah.
One thing I have also realized that sometimes the pain does not tell you that what is happening in your shoulder. Suppose we are talking about shoulder. So suppose if there are so many movements for body parts: flexion, extension, rotation. So suppose if I am experiencing pain with rotation, that doesn't mean that I will also feel pain while extension or flexion. So we should also consider that, okay, which movement is causing pain, and the other 2 or 3 movements, they are not causing pain. We can keep doing those movements which are not causing pain. So if a shoulder or my lower back is causing me pain in a certain movement, but there are 2-3 other movements which are not causing pain, we can continue doing that, right?
Right.
And then there is a range of motion, is the pain is continuously through all the range of motion with certain movement, or if you go up to certain limit, then it is occurring. So we should consider all these things, and that we can set a tolerable limit, that okay, this is the tolerance limit for my pain, and start moving under that tolerance limit, and slowly
Right.
that tolerance limit goes up, right?
Exactly.
So
So as you said, like exploring movements, like trying out various range of motions and finding like where you feel most comfortable.
yeah.
Uh, those things will help you like keep moving, and it will also gradually like lower your pain that you have been experiencing.
Okay. So if I have to summarize this, like, if you want to get better, if someone who's listening to this and they are dealing with some kind of chronic pain, and it has been certain amount of time has passed, that means they're not it is not necessary that there is some tissue damage is associated. So what they can do, they can get more knowledge about it, they can start more reading about the pain, and
Yeah.
they can try to find out their triggers. Apart from tissue damage, what are the triggers that might be triggering their pain, their emotional state, their stress, their sleep
Right.
lifestyle and all. And then they can explore movements. Instead of completely stopping the movement, they can explore what movement they can do and how safely they can return back to the movement, right?
Exactly. Yeah.
Okay. So next thing I want to ask you is, what has motivated you to read more about pain, and is there something you have dealt with? So, and if after reading this, how it helped you?
So with my lower back pain only, I got into pain science and reading about pain in general. So when I was able to like get the understanding like of how pain works, I was able to like modify my training, and then I slowly got back into movement, and my training also went well. So it's been like more than 6 months. In this 6 months, I've had like experience lower back pain experience for like couple of times, but since I had this understanding about pain, I was able to like manage it very easily. So I went back to my old routines of like training like at a tolerable level of movements, and then like working on my life, other life stresses, working on my sleep cycle. By doing this, I was able to like manage my pain very effectively, and uh, right now I don't have any like lower back pain, like even like when I do like heavy lifts and all.
Okay. So I have also experienced similar things, that earlier my pain it was associated with lot of fear, because once it is a lower back injury, you are like everywhere there is so much fear associated with lower back injuries. And if you start reading online also, there are so many things which you will read, and you will be so much fearful, and that was also affecting my mental health. And as you said, once I started noticing these things, and that has also helped me a lot, because these internal injuries, one thing is that if something you have scratched, you got a scratch on your skin, and you can see the healing process. You see that after 2-3 days it starts healing, and it is
Right.
getting better. Your brain is sensing that your injury is getting better. But these shoulder pain, back pain, you are not seeing what is happening inside. Your injury
Right.
might have healed way back, but you don't realize it, because you are not seeing it. Your brain is not sensing the healing process, and the same healing process is going on in the background. Your immune cells are coming there also, and they are repairing whatever injuries you caused. So because we are not seeing it, we perceive there is more fear associated with it. And
Right.
there is one more interesting example is there, where if doctors or nurses are giving you injection, and people used to look away, because when they are looking away and they are not looking directly into it, the brain feels less threatened with that needle than
Yeah.
looking directly into it. So it is lot about fear is associated with certain injuries that makes them worse. So
Right.
talking about these things and having a better perspective about it can help a lot.
Right.
So one thing I would like to ask you, if someone is listening to this and they want to read more authentic and more information about this, where should they go and read more about it?
Okay. The website and a short video I would recommend is it's called the website is called Tame the Beast.
Okay.
They have a 5 minute video of explaining pain.
Okay.
So it will be like so easy to understand.
Okay.
So that is the one main thing I would recommend. Apart from that, I find Pain Revolution website and Pain Toolkit to be like very helpful in manage. Like these website teaches you to self manage pain, and these websites also expand into other areas like mental health. Exercise activity guidelines. So those areas also these websites expand into, and they will provide like free guidance on those things as well.
Okay.
So as I was mentioning, like managing life stresses is also a main thing in pain experience. They have like lot of resources on mental health, like how to get back into activity, when to like check in with your physio or a general physician when you're experiencing pain.
Okay.
So those things are like these three websites are really good at it. Tame the Beast, Pain Revolution, and Pain Toolkit. And if you want to like really read through about every like what, like you mentioned, like what is happening inside our body, like how our brain communicates with our nervous system. So those things, if you want to read, you can check the Pain Science website. They have like detailed articles on like most of the pain we encounter.
Okay. And if people want to find you and talk to you about this information which you have shared, are you active on any social media where people can find you? What is your handle if you are active on any social media platform, or how people can contact you?
So I'm fairly active on Instagram. So recently I started posting about pain related posts, how to self manage it, and explaining like what is pain in general. So my Instagram handle is Muthu underscore MK8. So that's my Instagram handle.
Okay.
So apart from that, yeah. Carry on. That's
okay. So let me just summarize this whole discussion, and then I think there are other aspects also, and further we can have another podcast where we can different lot more about pain. And specifically I wanted this is a very general podcast on pain where we are just giving a starting information, and if you want to go into the deep discussion, I wanted to have another discussion on pain specifically related to lifting. So people who are doing weightlifting, what kind of pain they experience and how can they tackle that. So sometime if you get time, we can discuss that also later.
Sure.
Yeah. So to summarize this, like first thing we have discussed that pain is a brain generated activity. Brain is a complex thing, so there are a lot of complexity related to pain. Pain is just not simply tissue damage. That is one thing.
Exactly.
And we should consider other factors also. They play a huge role in your pain sensing, like your emotional state, your belief systems, your mood, your stress in life, and your negative emotions, your fear associated with that pain, your environment, and your history of chronic pain, your sleep, your diet, and your lifestyle, smoking, drinking, lot of these bad habits, and then how much you are moving, whether you are moving or not. So this is not just a one-dimensional thinking that I have a pain, that means a tissue damage. There are a lot of factors involved which play a huge role. That is second thing we have discussed. Apart from this, we have discussed how we can rethink and we can have a better understanding about pain, is to have a more knowledge, broad spectrum about pain, and then we can try to explore certain movements. You can try to manage your stress, manage your sleep, manage your lifestyle better, exercise, movements, and then there are other strategies also. Like you can take a health expert's advice, you can talk to your coach, you can get the support of someone who has already gone through something similar. So these things also one should consider while trying to get better through any pain. That is what we have discussed. And apart from that, you have mentioned some of the sources where they can go and read more about it. So yeah, I think we have covered good part of it, and I'll thank you again for joining me here. And I hope we will have some more discussions, not only on pain, but some more discussions about certain things about fitness, related to fitness and nutrition science.
Yeah, definitely, Rakesh. Thank you so much for having me on your podcast.
Yeah. Thank you.